Our scenario: a 44-year-old patient is ordered a myelogram for a suspected herniated disc in his spine. His history reveals he has hearing impairment in both ears as a result of meningitis as a 4-year-old boy. The physician rules out Cauda-Equine syndrome. Surgery is recommended for a laminectomy. Explain to the patient and the family the treatment, medications, and rehab for the procedure.
Hi, my name's Jenna. I'm going to be your nurse today. I'm going to take over for Jackie, who was here with you.
What?
Does he have trouble hearing?
Yeah.
Okay. Can you read lip? Okay, my name is Jenna, and I'm going to be your nurse.
Okay.
Did Dr. Feelgood come and explain your myelogram already?
Yeah.
Good. Okay. Then I just need you to sign this paper. It's an informed consent saying that it's okay to go ahead with this myelogram. Okay? Here you go, sir.
Where am I signing?
You sign right here. Thank you.
The myelogram, a diagnostic tool that permits visualization of segments of the spinal cord that may have herniated or may be compressed. This is usually done after an MRI is found inconclusive or an MRI is contraindicated for the patient. Contrast dye is injected into the spinal column before the procedure. The dye appears on X-ray screens, allowing visualization of the spinal cord, subarachnoid space, and other nearby structures seen more clearly than with standard X-rays of the spine. A CT scan is also used during this procedure to clearly see the spinal structures.
All right, Mr. Mayherd, I'm just going to get your vital signs and do a quick assessment. See your arm. Under your tongue. There you go. 98.6. Your blood pressure is 124 over 84. And does it work? Okay.
What's that thing do?
It's measuring how much oxygen is in his body, how much percentage he has. So
What?
measuring your oxygen, telling you how good you're breathing. Okay, now I'm just going to do an assessment on you, okay? So, do you have any pain right now?
Yeah, in my back.
Okay. On a scale of 0 to 10, 10 being the worst, what would you rate it?
I'd say it's a 4 if I'm just laying still. But
Okay.
if I'm trying to walk, it's like a 7.
Okay, where is the pain? Is it your upper back or lower?
Lower.
Okay, middle.
Kind of towards the middle, yeah. But the pain radiates down my legs also.
Okay. Do you have numbness and tingling in your feet or legs?
A little bit, yeah.
Okay.
Definitely towards my feet more.
Okay. Let me just take a listen to you, and then I'm gonna check out your legs and all that to make sure everything's functioning. Just breathe normal right now. And I'm just gonna listen to your stomach. Okay. Are you having any pain in your stomach at all?
Mm.
Okay, good. And then can you lean forward for me?
Okay.
All right. Okay, and you can lay back down. Does it hurt to move like that?
A little bit.
Okay. And let me take a look at your feet and legs. Alright. You're not having any swelling, any pain when I do this?
Mm-mm. Just a little bit numb, like I said before.
Okay. Can you move your feet? Okay. Can you pull against me? Good. Push. Good. Can you bring your knees up towards you at all? Okay, that's good. And back down. Good. All right. All right, well, they should be up here soon to take you down for that myelogram. Do you need anything else before I go?
I think I'm okay.
A herniated disc with accompanying pain may occur in any portion along the spinal column. In the lumbar region, manifestations include the following: low back pain with muscle spasms, sciatica, which is pain and tenderness that radiates along the sciatic nerve through the thigh and leg, muscle weakness, alterations in tendon reflexes, and sensory loss. In the surgical region, manifestations include the following: neck and shoulder pain and stiffness, pain and paresthesia in the arms and hand. Medical management is the first line of treatment for the herniated disc diagnosis. It includes the use of NSAIDs and systemic corticosteroids to reduce inflammation and swelling, analgesics for pain management, muscle relaxants when muscle spasms are present, moist heat and massage, patient weight reduction, physical therapy to strengthen supporting back muscles, biofeedback, and cervical immobilization with a cervical collar, traction, or brace.
Vital signs and lab results. Temperature 98.8, pulse 88, respirations 18, SpO2 97% on room air, blood pressure 136/82, pain 8 out of 10 described as aching, dull, and constant in the lower back. White blood cells 6.2, red blood cells 4.82, hemoglobin 15.1, hematocrit 45.6%, platelets 260, BUN 10.2, creatinine 1.1.
Great. Hi, Dr. Feelgood.
Morning, Jenna. How are you today?
I'm good, thank you. How
Good.
are you?
So what's going on?
All right, I have Otis Mayhurt in room 2. He's a 44-year-old male. He just came back from his myelogram.
Okay.
I think the results are in and they need interpreted.
Okay.
And I'm just warning you right now, he does have a little bit of hearing loss, so
Okay.
you have to speak loud. He can read lip, but just make sure you speak directly to him.
Okay.
And the wife is in the room as well.
Okay, great.
All right?
So we'll have some help answering questions.
Yes.
All right.
Responsibilities with hearing impairment. Orient the patient to your presence before initiating conversation. This may be done by gently touching the patient or moving so that you can be seen. Speak directly to the patient while facing him or her. If the patient is able to lip read, use simple sentences and speak in a quiet, natural manner and pace. Be aware of your nonverbal communication and gestures. Use sign language or finger spelling as appropriate. You can use electronic sign language translators if one is available. Write any ideas that you cannot convey to the patient in any other manner. Be sure that hearing aids are clean, functioning, and inserted properly if present.
Good morning, sir. Are you Mr. Mayhurt?
Yes.
My name's Dr. Feelgood. I'm the surgeon here. I'll be helping to take care of you. So what's going on?
Just been having some lower back pain with some numbness and tingling in my feet.
Okay, how long's that been going on?
About 2 months now.
All right. You do anything strenuous at work?
I'm a welder, so I do lift a lot of heavy metals and materials and stuff.
Okay. So we had you come in today. We ran a little test called a myelogram, and I don't think anybody was here.
No, I walked out of the room.
Okay, so I'll explain it a little bit to you. So he had what's called a myelogram. We actually put a needle into the spinal cavity, and we're able to inject dye to help us visualize the spinal cord and to see if there is any type of deviations from what a normal spinal cord would be.
Did you find anything?
Yes, we did actually. The results came to me right now. He actually does have a herniated disc right here. You can kind of see there's the needle there that we put in him.
Yeah.
It's actually quite a sizable needle, but right here, this white out here, we can actually see that that is a herniated disc.
What does that mean?
So what that means is that's a bulging disc that could have been caused. Obviously, he said he's a welder, so a lot of repetitive activity could have caused this herniated disc to progress to this full-out injury to where he has back pain when he's moving. Along with that, he has the numbness and tingling in his legs.
What are you guys going to do to treat it?
Well, I can recommend that we do what's called a laminectomy. So this is where we'll actually take out that herniated disc and we'll actually fuse the bones in the spine to help.
You're gonna fuse the what?
We're going to fuse your bones in your spine, your vertebrae.
Oh.
So this is a very simple procedure. It doesn't take very long. It's not a major surgery. You will be going under anesthesia for that. The recovery time depends on how well the patient does as far as therapy goes. We'll also have medication treatments to help with pain, as well as any type of muscular pain and spasms that can occur.
Okay.
Well, can he die from this?
No, he cannot die from it. It just puts a very big damper on his quality of life.
Okay.
So, are you okay with us doing this surgery? It's all up to you if you want to do it.
Yeah, let's do it.
Okay. So we'll go ahead and have Nurse Jenna get the consent forms. I explained it pretty good, but she can help go over any other points, and she'll call me if we have any other questions.
A laminectomy is the removal of the bone between the spinal process and facet pedicle junction to expose the neural elements of the spinal canal. This allows the surgeon to inspect the spinal canal, identify and remove pathologic tissue, and relieve compression of the cord and roots. The risks involved with this procedure include bleeding, infection, blood clot formation, nerve injury causing weakness, numbness, or paralysis, and spinal fluid leakage.
All right, I'm also going to check your reflexes here. See how your reflexes are on your lower extremities.
Doesn't feel good. He does have some numbness and tingling, he does say. It hurts more when he walks. But
Okay.
sitting down, he said he's about a 4 for the pain. I did an assessment on his lower extremities. They are okay. He does have some pain while he moves his knees upward towards his body.
Okay.
But he does have full movement though.
All right. I'll go ahead and assess his lower extremities here. Okay, so his reflexes are a little bit diminished, and that's to be expected, especially with these type of injuries to his spine.
Okay.
Can you push your feet into my hands? Okay. Now against my hands. All right, very good. All right, and his circulation's good, so that's a very good sign there. All right, are you allergic to anything?
Not that I know of.
Okay, so I'm gonna go ahead, I'm gonna put the orders in,
Okay.
and we'll be taking you down here for surgery. Any other questions for me?
Not that
No,
I
I
can
think-
think of.
Okay, alrighty, I'll see you in a little bit. Okay, nice to meet you folks.
Nice meeting you
Okay,
too.
we'll see you later.
Dr. Feelgood?
Afternoon, Jenna, how are you?
Good, thank you.
Good.
How did Otis Mayhurt's surgery go?
Mr. Mayhurt is doing well. We fused his L3 and L4 vertebrae. His pain should be totally relieved. He shouldn't have any of the numbness or tingling in his legs.
Okay.
I'd love to see him ambulated here. If he's still too groggy, that's okay. We'll just have to get 2 assists.
Okay.
I'll do the dressing change tomorrow. If all goes well today, and then we ambulate him tomorrow and he's doing even better, we might just send him home that next day.
Okay.
If his pain is way too intolerable, we'll probably keep him another day.
Okay.
All
Sounds
right.
good.
Any other questions?
No, that's it.
Okay. Oh, I also started a vancomycin order, post-op, 1 gram every 24 hours.
Doctor, I don't want to correct you, but he does have hearing loss already, and I know vancomycin does have ototoxic effects. So
Oh,
we probably
okay.
shouldn't give him vancomycin.
you know, you're absolutely correct. That's a good catch.
Thank you.
Okay, I'll go ahead and change the order to cefepime. Okay?
Okay.
All right. I'll see you up on the floor in a little bit when we
Alright.
get him up.
Sounds
okay?
good. Thank you,
All right,
doctor.
yeah, thank you.
Post-operatively, the nurse is responsible to ensure that vital signs are checked frequently, the wound is inspected for hemorrhage and infection, assessment of sensation and motor strength of lower extremities, color and temperature of lower extremities, assessed for urinary retention and bladder distension. The nurse is also responsible for patient positioning. The nurse will place a pillow under the head and elevate the knee rest slightly to relax the back muscles. Avoid extreme knee flexion when side lying. For turning, the patient is instructed to log roll with the pillow between their knees. Regarding ambulation, most patients are able to ambulate on the same day as surgery. To get out of bed, the patient lies to one side while pushing up to a sitting position. At the same time, the nurse or a family member eases the patient's legs over the side of the bed. Sitting or standing posture is accomplished in one smooth movement. Sitting is discouraged except to have a bowel movement.
Good morning, Mr. Mayor. How are you today?
Good.
How are you feeling today after your surgery?
Better.
Good.
I have no more numbness and tingling in my legs. So.
Okay. Very good. Well, we fused your L3 and your L4 vertebrae, so that's where the herniation was. So obviously, like you said, the numbness and tingling is gone. You shouldn't have any more pain. The only pain you should have should really be where your incision is on your lower back, okay? I'm actually going to change your dressing today. We're going to get you up here and see how you do. And if all goes well, we can actually send you home here tonight.
Okay.
Alrighty? So I'm going to have Jenna here help me out with changing the dressing.
Okay. We're going to have to lay you back. We're going to have to lay you down. And this pillow is going to go in between your knees. Just keeps everything stabilized when you turn, okay? I'm going to have you cross your arms. There you go. And this pillow is going to go right in between your knees. Okay. You're going to roll towards me. Ready?
Yeah.
Good.
Alright. This dressing isn't saturated, so that's great. Sorry, just going to take some tape off here. And his incision looks very good. Surgical glue is intact. Alright, so his incision looks fine. So now we'd like to see you ambulate here for the first time here. I understand you were a little bit too tired last night from the anesthesia, and that's to be expected. So are you having any pain right now?
Just the pain in my back from the incision.
Okay. If you need pain medicine, I can have Jenna go get you some, okay?
Okay.
So we'll have Jenna here ambulate you, and I'll find somebody else to help out, okay?
Okay.
If nobody else here, I'll help you out myself.
Okay.
Okay? Alrighty. So I'll be back in here to see you here, alright?
Alright.
So I'm going to grab your legs and I'm going to swing them over the bed. And then as I'm doing that, you're going to want to sit up, okay?
I'll help you on this side here, Jenna.
Okay. If you just want to make sure he doesn't go backward.
Mm-hmm.
Ready? Does that feel okay? All right, we brought a walker just in case. We're just gonna see how you do with this first walk session, okay? And just stand here for a minute. Do you have any dizziness? You feel like you're gonna fall over or faint?
No.
Okay. We're just gonna have you walk to the end of the room and we're gonna come back and sit you back down. Good? Sit slow. Good.
How'd you do?
I think okay. How did I do?
You did spectacular. So the plan now is we're going to actually send you home tonight after dinner.
Okay.
Okay? I'll get the discharge instructions set. We're actually going to send you home with a few prescriptions. We're going to send you home with some oxycodone and acetaminophen or a Norco. So that'll help with the incisional pain and any other pain that you have. We're also going to send you home with something called Flexerol. It's an anti-spasm drug, and that should help relax the muscles in your lower back. All right? You have any other questions for me?
I have a question.
Yes.
How is his quality of life going to be?
Well, as of right now, and that's another thing I'm actually going to bring up, we are going to recommend that he does go to physical therapy, outpatient. So 3 times a week is usually the best schedule that we'll have him on. So it just allows him to still be active. We're also going to give him some good rest periods too.
Is he going to be able to go back to work and be normal?
Not for about 6 weeks actually. So he's actually going to be taking some downtime here. No heavy lifting, no rotating your spine. So you'll have to have somebody else do a lot of your heavy lifting. Okay? So any other questions besides that? Alrighty. It was a pleasure taking care of you, Mr. Otis Mayherd. Alright?
Thank you, doctor.
Yeah, thank you. Take care.
Okay, let's get you back in bed.
What?
I'm gonna get you back in bed.
Rehabilitation. Outpatient physical therapy is usually recommended. Exercises to strengthen abdominal and erector spinal muscles will be used. Activity will be gradually increased as tolerated. Heat may be used to relax any muscle spasms that occur. Scheduled rest periods should be incorporated throughout the day. Heavy lifting and activities that produce flexion strain should be avoided. If pain is persisting, a back brace or corset may be prescribed.
Mr. Mayhurt, I'm back. All right, I have your papers here for discharge.
For what?
Discharge, that means you're going home.
Oh, good.
So I have a little paper here that we gotta go over, just some information for you for when you go home. Okay. So as you know, you had the procedure. You will have some minor pain for a couple weeks, just until that's healing. You shouldn't have a lot of numbness or tingling anymore in your legs. So we should be okay there. We are sending you home with 2 medications.
Should I call you guys if the numbness and tingling comes back?
Yes, I will get that to there when we go over when to call if you experience any problems.
Okay.
So the first medication that we're sending you home with is hydrocodone or Norco. I will let you see it, because I know you have some trouble hearing. Okay. Norco is a narcotic, so no driving because it can cause drowsiness or dizziness. We want you to take 2.5 milligrams by mouth every 3 to 6 hours as needed. Do not exceed more than 5 tablets in a day. Like I said, no driving, and it can cause a little bit of nausea or even like itching. So if you experience any of that, you can always give us a call if you're concerned, or you can take like an over-the-counter Benadryl. Also, it can cause constipation, and we don't want you like straining yourself while having a bowel movement. So if that does happen, we suggest taking a stool softener. And like I said, if you do have any concerns, you can always give us a call. The second med is Xanaflex. That's going to help with those muscle spasms because your spine is still adjusting since he's fused them. So you might experience spasms. If you do, that's what this is for. We want you to take 4 milligrams by mouth every 8 hours as needed. This medication can also cause that drowsiness that the Norco does too, so no driving. Next, we're going to talk about that wound that you have on your back. It's a very small incision. So there's a thin layer of surgical glue that will dissolve on its own. While you have that on though, we don't want you submerging in the tub, so no bathing. You can shower, that's okay. You can shower with the dressing off, just soap and water over it, that's it. And I know you will probably be helping him because he can't really see what's going on back there. And then after he's done, just pat it dry, put a Band-Aid, and we'll send you home with some Band-Aids just to cover that up.
Okay.
Next, for activity, we want you, for the first 2 weeks, don't lift anything heavier than 10 pounds. We want you to walk several times a day. That is encouraged. But we don't want you straining yourself, no vigorous activity, no sports, nothing like that. The 2 weeks after the surgery, that's when you start physical therapy and rehab. That's going to help you strengthen those back muscles back to normal. They will also teach you proper body mechanics to lift things when you go back to work, all that. In 6 to 8 weeks, that's when you should be released. I think Dr. Feelgood said that within 6 weeks, you should be okay to go back to work. But I think he said when you go back to work for 6 weeks, he wants you to do light lifting, nothing crazy heavy. Okay? Lastly, I have some concerns or symptoms. If you have these, then you should call us immediately. So if you develop a fever higher than 101 degrees, then you should call. If you have headaches, so these are specific headaches. If you have headaches if you're sitting upright and it goes away, or if you have a headache sitting upright, and then if you lay down flat, it goes away, we want you to call us because that could mean you're leaking spinal fluid from your spine, okay?
Oh, okay.
Wound drainage, this is gonna be more for you. So if you see any kind of drainage that's increasing out of that small incision, we want you to call. If it turns kind of like a yellow greenish color, it has an odor, then you should call. That could mean.
You said if it increases?
Yes, so right now there's a very small amount. If it starts seeping through Band-Aids and stuff like that, then call us because that could be concerning. If you experience any worsening numbness or tingling in your legs, call us back. And obviously you can always give us a call if you have any questions or concerns. Do you have any questions right now?
think I'm good to go.
Okay, I'm gonna get that IV out of your arm and then get you out of here.
Okay.
Guess who just got reinstated? Well, not officially. It's all right. It's all right. I'm a doctor.
That does not give you a lot of confidence.
I'm a doctor, as far as you know. And if you're addicted to lunch meat, the solution is very clear. It's time to quit cold turkey.